Hi, the topic I'm going to discuss today is workplace bullying in nursing and how it affects patient safety and healthy workplace. My target audience for this presentation are all the registered and the student nurses working at the hospital. So what is bullying? Bullying relates to persistent, insulting, violent, threatening, or offensive behavior, abuse of authority, or unreasonable penalties that make recipients feel embarrassed, susceptible, or endangered, thereby generating stress and sabotaging their self-confidence. Bullying can be horizontal or vertical. Horizontal bullying relates to acts committed by co-workers at the same level, while vertical bullying happens at distinct stages of the hierarchical scheme between people. The prevalence of workplace bullying in nursing is alarming. Behaviors can be emotional, verbal, or physical acts, including aggression, speaking behind someone's back, ridiculing or insulting a colleague in front of others, unjust blame, being treated differently from others, rejection, social exclusion, humiliation, unnecessary request, verbal abuse, and refused opportunities. Such behaviors are allowed to happen in the hospital due to fear, lack of confidentiality in regard to reporting, or insufficient monitoring of management and complaints, or not knowing where to get assistance from and concern for their job. What are the impacts of bullying? Bullying affects every aspect of the individual, such as psychological, physical, social, and emotional. Bullying increases the incidence of psychological stress and depression, eventually leading to greater burnout rates. Detrimental impact of bullying doesn't stop with the victim targeted, but also affects the safety of the patient under their care. The influence of bullying threatens patient safety and care. It is challenging to provide compassionate, safe, and quality care to patients when nurses are working in an environment of coercion, humiliation, and imbalances of power. A survey conducted by the Institute for Safe Medication Practices shows that 7% of the nurses were involved in medication errors as a result of workplace intimidation. Another study shows that bullying leads to loss of professional responsibility and dedication towards patient care. Bullying in workplace can lead to severe negative outcomes for patients because the nurses are less likely to ask questions or seek help. They discovered that a large proportion of nurses report performing activities that could endanger patient safety rather than seeking assistance from their colleagues, which included lifting bedridden patients on their own, slogging through patient processes that they weren't confident with, and using equipment they were not acquainted with. Moreover, patients are not only exposed to medical errors and adverse events due to bullying, but are also exposed to enhanced mortality. Teamwork, collaboration, and communication in such a setting are also impaired. This culture can affect interaction among nurses that eventually creates an unhealthy workplace and threatens the security of patients. Inability to stick to professional duties and inappropriate interpersonal behaviors lays the right foundation for unhealthy working environments. In nursing, bullying is widely regarded and generates a damaging atmosphere in the workplace. Nurses working in a culture of bullying experience job discontent, which leads to poor performances, higher levels of sick leaves, professional disengagement, rapid job turnovers, and reduced productivity, happiness, and morality in the workplace. New graduate and student nurses are more likely to experience bullying than the senior nurses due to their lack of experience and training. A latest study of second and third year nursing students, revealed that more than 57% of students had encountered non-physical abuse while in the clinical environment. It was also discovered that more than 33% of the second year students had encountered some type of physical violence, such as punching, kicking, or slapping, in which case perpetrator was a patient, colleague, or registered nurse. In nursing profession, bullying is so deeply rooted that it now exists as a culture of the workplace. Australia's nursing culture is characterized as poisonous, detrimental, and hostile. A survey conducted in Australia among the registered nurses and midwives in Victoria showed that 52% of the nurses had experienced some sort of bullying behavior. So what are the actions undertaken? Australia's growing presence of bullying is reflected on the latest policies in Nursing and Midwifery Board of Australia. The Federal Parliament of Australia enacted amendments to the Fair Work Act on 27 June 2013, setting out fresh norms and specific workplace bullying provisions. The Nursing and Midwifery Board of Australia had released a new Code of Conduct for nurses that was effective from 1st March 2018, clearly stating a zero-tolerance approach. What role does effective leadership play in stopping bullying? First of all, what is clinical leadership? Clinical leadership skills are described as behaviors of nurses that provide guidance and assistance in the delivery of patient care to clients and healthcare team with 5 important features, which are clinical expertise, efficient communication, cooperation, interaction, and interpersonal comprehension. Nurse leaders play a crucial role in preventing bullying by indicating a strong dedication to eliminating bullying in the workplace and clearly promoting an open culture in which unacceptable behaviors are resolved promptly. Transformational leadership is linked with lower rates of harassment because it gives higher autonomy, freedom, and authority to the followers. In transformational leadership, followers are more likely to be intellectually encouraged to think about their work duties, including how to take proper action to efficiently manage their work. Also, transformational leadership evokes trust, positivity, and confidence in followers, which should help them overcome uncertainty and difficulty connected with the use of job autonomy to shape their work experience. Transformational management therefore acts as a signal to supporters to practice their independence and offers advice on how to do so together, which allows followers to better deal with misuse of authority and solve any interpersonal problems that occur. Transactional leadership, where leaders work together with their working groups and concentrate on efficacy and stability, are also linked with reducing bullying behavior. There is an expectation that new graduate nurses will quickly develop clinical leadership skills to provide secure, high-quality patient care. In order to fully realize their position in practice settings, new graduate nurses need to possess sets of leadership skills that helps identify and react to challenges they face at work, which also includes bullying. Newly skilled nurses consider leadership solely to be the duty of senior employees, but the professional standards of practices and behavior for nurses and midwives states that all nurses should be a model of integrity and leadership for others to aspire to, which means nurses should be able to lead at any stage of their career. What is scope of practice? Scope of practice is best defined as the boundaries that a nurse must work within. The main requirement is that we should only be nursing to our level of training, knowledge, and experience. Scope of practice is that nurses are educated, competent to perform, and permitted by law. Scope of practice is influenced by the context in which the nurses practice, the health needs of people, the level of confidence of the nurse, and the policy requirement of the service provider. What are the legal and ethical boundaries of nursing practice? All nurses are required to work under the ethical and legal frameworks that are governed by ANMC Competent Standards, Code of Ethics, and Code of Professional Conduct to provide quality and safe nursing care. Workplace bullying and harassment are not only psychologically destructive but also violate current legislation and standards. There are several ethical principles and codes that are violated by nurses who engage in bullying behaviors, such as principles of beneficence, non-maleficence, and justice. So what are my main objectives for communicating information in this way? It is to support registered nurses, new graduates, and student nurses to understand, identify, and prevent bullying and the impact it has on victim, patient safety, workplace, and organization as a whole. The main goal is to raise awareness and empower the staff to recognize and respond appropriately to bullying, to provide support to students and new graduates who has been affected, witnessed, and engaged unknowingly to the act of bullying, providing information about anti-bullying policies, and to encourage students and new graduates to disclose and discuss incidents of bullying. How does it support effective leadership? As we all know by now, effective leadership can enhance motivation and empowerment among nurses, maintain a motivated work environment, and achieve and maintain high-quality patient care. Skilled communication is the primary instrument that leaders use to foster self-confidence and inspire confidence within their teams. My presentation supports effective leadership in such a way. Its main aim is to provide support and empowerment to nurses, raise awareness about bullying, to create a safe and healthy work environment, and to provide quality patient care through skilled communication. Thank you.